Okay, so I have a 65-year-old patient who just finished her treatment today with osteoarthritis. So her pain reduced a little bit with the treatment from an 8 to a 5, but she's still experiencing pain. So I want to do biphasic pulse current 10s, high rate, to help reduce pain. So some indications that I would use this ESTIM for would be her pain, obviously. And then contraindications and precautions. Precaution would be if she has cardiac disease or undiagnosed pain, which her pain is diagnosed, so that's not something I have to worry about. And I would know from her history if she had cardiac disease, and we're assuming she doesn't. And contraindications would be if it's over or near a pacemaker, which I would ask if she has a pacemaker. And in reality, I'd probably still not do ESTIM, even if she had a pacemaker, so I guess we're just going to assume that she doesn't for this case. And I wouldn't do it over any skin with decreased sensation or damaged skin, and if she has any kind of thrombosis, which again I would know from history taking and medical records, and then just asking her myself. So I already set up the parameters, which I'll show you now, which would be a pulse frequency of 100, which I kind of picked middle ranges for both the frequency and pulse duration, just so that I have leeway to go up or down based off of patient tolerance. So that's why I picked 100 PPS for the frequency and 50 microseconds for the duration. And then treatment time in the clinic, I would do, it's typically 20 to 30 minutes. So for time's sake, I would do the lower end, and then I'm doing it on a portable unit, so I could have her go home with one and she can do it for up to 30 minutes at home. And then the amplitude of it is just a strong but comfortable tingle, which I'll describe to her when I'm putting it on her. So this is the portable unit set to biphasic and all the other parameters that I just described. Okay, so I'm going to go to the patient. Okay, it's fine. You don't see your face. Okay. Hi, Maddie.
Hello.
So we finished your treatment, and your pain is still decently high, but it's a little bit reduced from normal. Okay, so I know we've gone over history, so I feel confident that we don't have any contraindications for using ESTIM. But this is something I want to try on you to help reduce your pain a little bit more, help you feel a little better in your knee joints. So we're just going to do left knee for your osteoarthritis and reduce that pain. So essentially what's going on is I want to stimulate some of your sensory fibers more, so that when they go to the spinal cord, they're kind of blocking where your pain fibers would be going. And so it's to help reduce that pain. Okay? And I will teach you after the treatment today how to use this portable unit so that you can go home and do this at home. And you can do it for about 30 minutes at a time. Okay. So the sensation I want you to feel, we're not trying to contract any muscles. Again, this is just for sensory stimulation. So I want you to tell me when it's a strong but comfortable tingle. Okay. So I'm going to turn it on nice and slow here. Okay. And let me know when you start to feel anything. And then when you think it's strong enough for you to handle for 20 minutes. Okay. Let me know when it's nice and strong but still comfortable. Okay. Okay, and so now I'd reassess the patient. I just turned it down a little bit because I saw a little bit of muscle contraction, and we don't need to be getting those motor fibers. So you can handle a lot. Okay, so how is it feeling?
That's fine.
Good. And so again, the goal is to reduce pain in this area. We don't need to be contracting anything. So when you take this home, just go up to the point where it's comfortable, and I know you can probably tolerate more, but if you see your muscles contracting, turn it down a little bit. Okay? Awesome.